Hi there, welcome everybody. We'll give folks just a few minutes to fill in the room. Welcome to our first policy preview webinar for the year. All right, folks, welcome to the Colorado Children's Campaign Policy Preview webinar focused on health and economic security. This is one of two webinars that we'll have prior to the 2026 legislative session, with the next one on early childhood and K-12 education happening a week from today. We'll also have a series of webinars throughout the session to keep folks apprised of developments at the state capitol and the federal government. Today, we encourage folks to use the Q&A function if you have questions throughout the webinar. We'll be spending some time at the end to address any questions that come up. This webinar is also being recorded, and we'll be sure to send out the recording and the slide deck to all those who registered afterwards. So welcome everyone once again. My name is Riley Kitts, and I'm the Chief Policy and Research Officer here at the Colorado Children's Campaign. I really appreciate you all taking the time out of your busy days to hear about policies that affect Colorado's kids. Here at the Colorado Children's Campaign, we believe that every child deserves a seat at the table when public policies are made that impact their lives. But we know that kids can't vote or run for office, so we are their voice and their champion. The Colorado Children's Campaign has been the proud voice of children in policy and advocacy in this state for more than 40 years, and we're really proud to continue that work. We work to make Colorado the best place to be a kid and raise a kid. We use data and research to identify what kids across our state need most. Then we advocate for policies that strengthen their well-being and help them thrive. Our focus is on the whole child, working across early childhood, K-12 education, health, and economic security for the greatest long-term impact. So today I'll kick us off with some overarching themes, and then I'll pass it over to our brilliant policy staff we have with us today, Sarah Barnes, our Vice President of Policy, and Tony Sarge, our Director of Health Policy. They will be giving you some state level data and will be updating you on some recent federal and state actions. They will also start to look forward to policies and themes that we can all tackle in the upcoming year. But before we get started, we do have some very recent and exciting updates. Both propositions that were on the ballot just a couple days ago in support of healthy school meals for all passed with really good support. Just a reminder that there were two measures here. Proposition LL allows the state to keep funds already approved and raised for the Healthy School Meals program. And Proposition MM expands the dollars available for that program so that more kids get the healthy, nutritious food they need at schools. We want to give a big shout out to our partners, especially those at Hunger Free and those in the nutrition and hunger space. This was a tremendous win this week for Colorado's kids, and we couldn't be prouder of the work you all put forward. We really look forward to working with those partners and others to make sure this program continues to work and that the dollars in food are getting to the kids in schools that really do need them. Congratulations, and thank you for that tremendous win. So shifting from some great news to a little more somber, we're now going to give some federal updates and some state context as we head into 2026 and the upcoming legislative session here in Colorado. As we all likely know, federal instability is really directly harming children and families. The ongoing shutdown has led to funding delays that disrupt programs like SNAP and Head Start, putting access to food and early learning at severe risk. HR 1, or the sweeping federal tax package that was passed over the summer, will have huge implications on kids and families. Medicaid coverage for kids is at risk. Thousands of children, especially in low-income families, could lose health coverage. Shifting costs of the state will be hard to absorb, if we can absorb them at all, and will weaken safety net programs such as Medicaid, SNAP, TANF, and our Child Care Assistance Program. And we know that the health system instability is growing. Rising premiums and uncompensated care threaten the stability of the insurance markets and our hospital systems. And on top of all that, not necessarily included in HR 1, but just happening at the federal level, education and civil rights protections are being rolled back. Federal changes have weakened the enforcement of student civil rights and special education services, and that creates gaps in access and accountability. The bottom line is these federal shifts make state level leadership and investment essential to safeguard children's health, education, and family economic security. So we'll have some folks go into this a little bit more, but we wanted to provide on this next slide a visual timeline for what is coming down through HR 1, the big tax package that was passed around July 4th this last summer. So HR 1's tax cuts significantly reduce federal revenue and shift a lot of costs to states. And those shifting costs threaten the critical safety net programs that a lot of Coloradans rely on, like Medicaid, SNAP, and CHIP. And because our programs are so intertwined in this state, we also anticipate that we'll see impacts through other programs that we administer, other benefits programs, like temporary assistance for needy families, our social safety net program, or child care assistance, also known as CCAP in this state. Both Tony and Sarah will touch more on these, but just a quick overview here that's on this visual we'll make sure to send out to folks. Starting about a year from now, we're going to start to see changes in Medicaid, such as non-citizens like refugees, asylum seekers, and victims of sex trafficking no longer being eligible for Medicaid. And we'll start to see federal funding for emergency Medicaid begin to decrease. And on the SNAP and nutrition side, the state's administrative costs will increase from 50 to 75%. That's just a year from now. So there's a lot of work we need to do to get ahead of that. Then at the end of next year, end of 2026 is really when the bulk of those Medicaid work requirements start to take effect and we start to lose some eligibility, retroactive eligibility for a lot of clients. And then we need to contend with even more as we move into 2027. So looking ahead to 2 years from about now, October 27 is when we start to see even more impacts on SNAP, especially around matching funds that the feds usually put forward to administer the program. The state is going to now have to put forward most of that administrative cost. And then moving into 2028, we start to see a lot of Medicaid state directed payments decrease year over year. And that continues into 2028 for some time. All that to say is we have a lot coming our way, and we need to start contending with how we handle HR 1 here in the state of Colorado. And a lot of that work has begun and did actually happen a little bit prior. So moving on to how we are contending with HR 1, because of the passage of that federal package, lawmakers were called back to the Capitol in Denver for a special session in August over the summer. And legislators had to take steps to start to address HR 1, especially the immediate budgetary impacts that really amounted to more than a $750 million budget shortfall. So lawmakers did come together in late August and they acted to stabilize the health insurance market and do some work to make sure that our Healthy School Meals program allows some funding to go to SNAP, which was just approved by voters this last week. They also raised revenue by closing some tax breaks and tapping into our state reserves. And for the most part, they really did protect programs that benefit kids and families. But admittedly, they were a lot of band-aid solutions, and we need to start thinking of longer-term fixes to address our safety net and make sure that families have support. So as we start to then think about 2026, the current realities that we're sitting in, it kind of sounds like the same story, different day that we've had in Colorado here for a long time. Colorado is facing budget pressures. How many times have we heard that? It seems to be just the same story, different day type of scenario over and over. So once again, we had to make over $1 billion in cuts in the 2025 legislation. Legislators had to address an additional $750 million budget shortfall in the special session. And then looking forward to 2026, the legislature is estimated to be facing around another $1 billion in budget cuts for the next fiscal year. So once again, it does feel like the hits just keep on coming, but I want to give a shout out that A lot of folks on this call, a lot of the folks of the Children's Campaign have been working hard to make sure that children's programs are protected. And we really want to thank a lot of folks who have done tremendous advocacy, even in the face of these dire budget situations. We see a lot of programs protecting kids that are still sustained and are still supported at the state capitol. So once again, as we are looking forward to 2026 and some another round of nearly $1 billion in budget cuts for the next fiscal year, we do need to band together. Governor Polis just released his proposed budget last week, I should say, for the fiscal year that starts on July 1st of 2026. So a little about 9 months from now. We are hard at work analyzing that budget, and we'll have a lot more information to come, especially in our webinars in January and beyond. But from an initial look, the budget is in a dire situation. We're not going to sugarcoat that. We are looking at nearly $1 billion in cuts that need to happen to address our budget shortfall. However, once again, in this proposed budget, because a lot of the advocacy you all have put forward, we do see a lot of protections for programs that benefit kids and families. We know a lot needs to happen between now when this budget is finalized in April and May, but we really encourage folks to keep up that drumbeat about programs that are benefiting kids, especially those who are furthest from opportunity. And just really want to give a shout out to and thanks to advocates on this call who have been pushing the governor, pushing the legislature to make sure those programs are continued and supported. We look forward to working with you on this budget as it all unfolds over the next several months. So, like we said, we're not gonna sugarcoat thing, right? We are looking forward and we are gonna face some real challenges at the state. Deeper cuts are likely to keep on happening as HR 1 continues to unfold here in Colorado, especially with programs like SNAP and Medicaid that are particularly at risk. And at the same time, Colorado doesn't have the fiscal tools to address these issues. We are very constrained here. We have Tabor, we have constitutional spending limits, and we have outdated administrative structures that make it harder for the state to respond quickly and flexibly when we have changes come down from the federal government. And these pressures don't just affect health programs, right? It doesn't just affect Medicaid and SNAP. We're going to see other critical supports that are put at risk, like TANF, our temporary assistance for needy families, childcare assistance, and even our K-12 funding, which relies on a lot of data from SNAP and Medicaid in order to get dollars out the door in our schools. So the key takeaway here is that we need to act proactively to protect children and families because these cuts will happen and we need to address them now so that they're not harder to mitigate later. So, what is the Colorado Children's Campaign going to do about it? What are we as a state going to do to start to respond? Well, the Children's Campaign, we believe that when kids have someone to fight their fight, they can focus on being kids. So, we are going to fight their fight at the state capitol. First, we need to make sure that we're modernizing our safety net to help families achieve the financial stability they need and avoid gaps in support. Second, we're going to guarantee affordable, high quality healthcare coverage for every child and make sure that coverage is stable and accessible. Third, we're going to make early childhood care affordable, accessible, and effective. We need to address wait lists and support quality programs for every child. And finally, we need to make sure our schools are properly funded and ensure that students with special needs and disabilities are properly protected. We can do a lot here together in the face of a lot of challenges, and we look forward to working with you all. So today, Tony and Sarah on our team are largely going to focus on those first two buckets of work around ensuring our safety net is responsive and that we're actually meeting the needs in families and guaranteeing affordable quality healthcare. We'll make sure to highlight our early childhood and K-12 priorities at our webinar next week. And last but certainly not least, we wanted to highlight a resource we've produced for you all, the legislators and the public. We recently released this last month of October our Kids in Focus research brief series. These were a series of briefs that we put out that highlight key issues that we're seeing throughout the state. We first started off with a brief on childcare affordability. We released the next week a brief on child homelessness and the unfortunate rise of child and family homelessness in the state. And then we released two briefs on our safety net program, temporary assistance for needy families, and the need to modernize that. We wanted to identify these for you. We'll be sure to send the links out to these briefs after the webinar, and Tony and Sarah will be touching on some of the research findings as they go through their parts of the presentation. So we're going to get into some data now, right? We tried to do some level setting. We tried to give you guys as much as kind of context as we can. And then Tony and Sarah are really going to jump in here and give you a lot more detail in the economic security and health spaces. But we always thought it's a good idea to make sure we're level setting with demographics in our state and really giving the context of who kids are and where they are in this state. A lot of the information, a lot of the data you'll see today is pulled from our Kids Count in Colorado report. We are the state organization that does Kids Count. We put out an annual report, and we have a Kids Count data center, which is a data hub for a lot of publicly available resource. So you'll see a lot of information today. We will caveat this that due to data collection practices, a lot of the data you'll see comes from 2023, which is the best and most recent data available. We do work to regularly update data as it comes in. You will see some updates here today, but please always check with us and check with our data center for the most up-to-date data and information. So just a couple slides here about who are Colorado's kids. Well, there are about 1.2 million kids living in Colorado, making up about a fifth of our population. And almost a third of those kids are young. They're under the age of 6. So whether those kids live on the Eastern Plains, the Western Slope, the metro area, somewhere in between, we know that each one of them deserves the opportunity to reach their full potential. And just to give some recent trends here and some recent, breakdowns of who the kids are in our state, kids in Colorado come from a diverse set of backgrounds and set of experience. So among Colorado kids in 2023, just under half of the kids came from communities of color, and 1/3 of the children in Colorado are Hispanic. Children are living all across the state, with most of the population being centered in the Front Range. And we want to note here that as a whole, our state is actually seeing our child population declining. Between 2019 and 2023, Colorado's child population actually decreased by about 28,000 kids. However, just like other things we'll talk about today, we see a lot of different stories throughout the state. And when we really drill down into those averages, we start to see a different story. So 15 counties actually saw an increase in their child population, including Weld County up there in our northeast part of our state, where the child population increased by about 6,000 kids in that 4-year span between 2019 and 2023. So whether a county's population is declining or increasing, we know we still have over 1 million kids who need our help and support, who need access to high quality childcare, high quality schools, and high quality healthcare. So now we're going to jump into some ways we can help those kids out and address those areas. And so I'm going to hand it over to our brilliant Vice President of Policy, Sarah Barnes, who's going to dive into our first topic around economic security. Sarah, please take it away.
Thanks, Riley. Hi, everybody. Thanks for being here. My name is Sarah Barnes, and I'm the Vice President of Policy at the Colorado Children's Campaign. We'll start today by sharing just a few data highlights in economic security, specifically from our 2025 Kids Count report. We know that when, as Riley said, kids grow up in a stable, secure environment, they really can just focus on being kids. So this year, some new data helped us better measure how many families need more help in our state to make ends meet. And this data shows us that 30% of households with kids in Colorado are estimated to be experiencing financial hardship. And we'll share more about how we're thinking about this in the next few slides. So first, in 2023, 1 in 9 Colorado kids lived in poverty. This is roughly the same number of kids as has been the case in past years. This means that for a family of 4, they were making an income of $30,000 a year or less. There's a wide range in child poverty rates across counties in Colorado too. So for example, Douglas County had the lowest child poverty rate of 3%, while Costilla County had the highest child poverty rate in our state at 37%. But we all also know that there are many families who make well above the poverty level who are still struggling. And so we took a broader look at that in our report this year. So first of all, we saw that almost 30% of kids in Colorado are living below 200% of the federal poverty level, or double the federal poverty level, which means, again, for a family of four, that's making about $60,000 a year in income or less. You can see the red line on the graph here that shows the poverty line, or 100% of the federal poverty level, and how many kids in our state are living at or below that amount of income. And again, with these numbers, there's a great deal of variation by county. In addition, this year, the United Ways of Colorado launched what's called the ALICE tool, and this describes a household survival budget, or the minimum amount that a family really needs to make to meet their basic needs in each county in our state. So the tool showed that in 2023, on average, a Colorado family of four actually needed just over $93,000 a year in income to make ends meet. Again, this ranged by county. So, for example, you need nearly $126,000 in annual income in Summit County and about $68,000 a year in Bent County to make ends meet. Alice considers families who make below that household survival budget to be living in financial hardship. And so, using these new cost of living estimates, Alice found that 28% of households with kids in Colorado were experiencing financial hardship. The good news is that with these more specific tools, we can look at what families need and we can have a better sense of the true scale of economic security for families in Colorado. And we can target better solutions to really work to increase economic security for all families and kids in our state. We also want to specifically call out that in Colorado, about 65,000 kids are living in deep poverty. And again, this number has not changed very much in the last several years. Living in a deep poverty or extreme poverty is defined as making less than 50% of the federal poverty level. So in 2023, for a family of four, this meant that family was making less than $15,000 a year. Programs like the Temporary Assistance for Needy Families, or TANF, is specifically designed to support these families, including through cash assistance payments that can help families cover the cost of diapers, school supplies, and transportation. In 2023 in Colorado, 47,000 kids received basic cash assistance through the TANF program. And our recently released Kids in Focus series that Riley mentioned included 2 briefs on TANF where you can dig more into this information. Lastly, we want to note that between 2021 and 2023, 11% of kids in Colorado faced food insecurity. While this is better than the national average, we are also starting to see our progress in Colorado in this realm reverse. And given changes at the federal level that we're talking about today, more kids in Colorado are going to be likely to be at risk of food insecurity in the coming months and years. So we'll shift now to talk a little bit about policy problems and approaches to solutions that the Children's Campaign is focusing on in economic security for the coming year. You heard Riley talk about the timeline of HR 1 changes that are coming to Colorado. And from an economic security standpoint, the impacts of federal decisions are really going to have a ripple effect across our safety net for kids and families. There are big changes coming in Medicaid and SNAP, but programs like CCAP, our Child Care Assistance Program, and TANF will also be impacted due to the strains that those are going to cause on Colorado systems and budget. And it's also true that the families who are enrolled in these different programs are often the same families. For SNAP specifically, 50% of SNAP enrollees are kids. And the 317,000 kids in Colorado who are supported through SNAP are at risk of losing food benefits due to federal decisions. As a result of HR 1, the share of Colorado's budget that we will have to spend on SNAP is projected to increase drastically. In addition to that, new work requirements for families who have school-aged kids that are going to be coming into effect will mean added red tape that is very likely to translate to a loss of benefits for families. We're also really closely watching the government shutdown, as I'm sure you all are, and how that is impacting SNAP as well as other economic security programs. So this month in November, $120 million in SNAP benefits for Colorado families were not delivered on schedule from the federal government. The Joint Budget Committee, or the JBC in Colorado, came together and recently approved an emergency request to provide some additional funding to food pantries in the state to help respond to the increased demand as a result of families not receiving their SNAP benefits this month. Part of this was due to the fact that the federal government has indicated that states will not be reimbursed if they use state funds to provide SNAP benefits during the government shutdown. Since that time, a judge has ordered the federal administration to use emergency funds to provide SNAP benefits to states. But despite that, there is continued confusion over whether and when funds will actually be sent to states. And the federal government has also said that even if funds are provided, it's only going to be enough to cover about half of the SNAP benefits that families are entitled to in November. We're continuing to watch this very closely along with our other advocacy partners in the hunger space. I'll also note that WIC benefits for families are being impacted by the shutdown. The Joint Budget Committee also came together last month and made an emergency allocation to help cover WIC benefits for Colorado families in October, and Colorado is able to continue to utilize those funds to help families this month as well. So, speaking of the Joint Budget Committee and the state budget, as Riley mentioned, the governor's proposed budget came out last Friday, and this signals the start of figuring out how we will pass a balanced budget in Colorado for the next year. There's a lot to analyze in the governor's proposal, and we are digging in. There are a lot of cuts and reductions being proposed this year. Due to federal decisions and our state budget constraints, Colorado is going to have to make some more difficult choices this year about our investments. At the Children's Campaign, we're going to be advocating for solutions that will minimize the impact of cuts on the well-being of kids and families to the greatest extent possible. In economic security, we're looking in particular at proposals in the budget that are related to the TANF program and also to SNAP. And we're really digging into the details of those proposals, and we'll be back in January with more specifics in our next webinar. So in the upcoming 2026 legislative session, as we work to brace for impacts coming from the federal level like HR 1, and as we grapple with budget constraints in our state, Colorado needs to prioritize a focus on benefits getting to families across our safety net. Counties in Colorado with high child poverty rates, often those that are in rural areas of the state, are going to feel these impacts acutely. And in rural communities, they often have less infrastructure available to support families in other ways. Now more than ever, benefits for families should be the last place we look to cut costs in our budget. A new national report highlighted the impact that these programs like SNAP and WIC and TANF have on Colorado's child poverty rate, and found that 98,000 fewer kids experience poverty in Colorado as a result of these types of programs. Stabilizing the safety net for families means that Colorado needs to be as efficient as possible in how we administer programs so we can maximize the benefits that are going directly to families. So our goals this year across our safety net really need to be stabilizing the system to build a foundation for sustainability of Colorado's safety net in the years ahead, and mitigating harm to families to the greatest extent possible. At the Children's Campaign, we'll be focusing specifically on TANF in the year ahead. Again, given the impacts coming to Colorado from HR 1 to Medicaid and SNAP, we need to reform the TANF program here to be more transparent, effective, and equitable. We've seen recommendations for potential approaches to this in both the governor's proposed budget and in a document that was submitted to the Joint Budget Committee this fall by the Department of Human Services and the Department of Early Childhood. Our focus at the Children's Campaign this year is to ensure that with the limited TANF dollars that Colorado receives each year, we invest in what works, we track outcomes from that spending, and we get as many dollars as possible directly to families. A bill that passed last session, House Bill 1279, is going to provide the state very soon with more comprehensive data on how Colorado spends TANF funds, and we're looking forward to leveraging that data to improve our TANF program. And Colorado needs to identify solutions this year to stabilize TANF as we brace for changes from HR 1 to make sure that TANF in Colorado is sustainable and serving families in the best ways possible. And again, our recent brief on TANF highlights some strategies to achieve this. And lastly, I just want to highlight a very important tax credit that is cutting child poverty in Colorado. Refundable tax credits, which are tax credits that put money into families' pockets even when they don't make enough income to owe taxes, deliver some of the highest returns for child well-being and state prosperity. One new and important tax credit in Colorado is the Family Affordability Tax Credit, or the FATC, which was created in 2024, and it's available to families with children on a sliding scale based on income. The FATC is expected to make our child poverty rate the lowest in the country, and when it's combined with other tax credits, the child tax credit and the earned income tax credit, it's expected to cut child poverty in half in Colorado. The FATC was designed with triggers related to economic growth in the state that must be met for the credit to be available each year. Given the significant impact on child poverty of this credit, Colorado needs to prioritize ways to protect this credit for families to the greatest extent possible, especially those families who are making the lowest incomes in our state. And with that, I will turn it over to Tony, our Director of Health Policy.
Thanks so much, Sarah. Good morning, everybody. My name is Tony Sarge. I use she, her pronouns, and I'm the Director of Health Policy here at the Children's Campaign. I've been in this role for 2 years now, and I'm just really grateful and humbled to be able to chat with you all about some of the things we're thinking about as we head into our legislative session in the world of health. Similar to what Sarah just gave a little bit of an overview to is I'm grateful to highlight some of our kids count data from this year or from recent years. So first of all, here in this slide, we have seen really great progress in Colorado for reducing our uninsured rate for kids. So in the last decade, Colorado has cut our uninsured rate from 9% down to 4%, even better than the national average. And a great deal of this progress has really been due to expansions in public health insurance or Medicaid and CHIP in Colorado. However, unfortunately, with new data coming in this year that's not represented in this chart, we are starting to see some of this trend to reverse a little bit. New data just released a couple weeks ago shows that now 6% of children in Colorado are uninsured. And so this is something that we're watching and monitoring really closely and going to be continuing to address, especially with changes at the federal level. Some other really kind of positive insured data that we're seeing is in the 2023-2024 year, over 680,000 kids were enrolled in Medicaid or CHIP, with this increase in CHIP growing significantly, that green bar there in that last year. The CHIP program grew by about 70,000 kiddos in just 1 year from that shift from 22-23 to 23-24. Likely because after COVID and after the public health emergency unwind, where we had families being changing enrollment status for the first time since the public health emergency, we saw a lot of families changing income and coming out of Medicaid, but really grateful to see how CHIP is stepping in and working for those families who make too much to be in Medicaid coverage, but not quite enough to afford private health insurance. So really hopeful that we can continue to use this data to highlight the importance of the CHIP program in Colorado as a really strong way to keep children enrolled in health coverage, again, even despite changes at the federal level. So with those change uninsured rates that I just mentioned that we're starting to see trending now, keeping an eye on CHIP is going to continue to be really important for us to watch how those kids move from coverage spaces. So health insurance in that sense, is really important for all types of things that kids need, from their well child visits to their oral health to their immunizations. And in our oral health space and our immunizations, both are really we wanted to highlight because are struggling a little bit in Colorado. So we've been seeing more tooth decay among kids despite having increased access to dental care or dental insurance. In 22-23, 61% of third graders who took a basic screening survey had some level of tooth decay. So that's a pretty high number that we're concerned about and paying attention to, working with our oral health partners on. Additionally, immunization rates among kindergartners are lower than they were before COVID. But those are on the rise throughout the state, kind of depending very geographically on the region. For example, there are 9 small school districts around Colorado that actually have immunization rates that are below 80%, which means that these communities are at a real significantly higher risk of outbreaks in diseases such as measles that we're seeing right now. In a couple more slides, I'll dive into how Colorado is responding to potential access to vaccine changes at the federal level. So speaking of the federal level, as Riley and Sarah already mentioned, as we sit here today, the federal government has been shut down for our longest shutdown in history. And this is truly mainly tied to a debate in Congress over whether to extend the enhanced premium tax credits under the Affordable Care Act marketplace. So these enhanced premium tax credits, or EPTCs, help millions of Americans afford their health insurance premiums. And if these tax credits expire, many individuals who get their health insurance through the marketplace, or in Colorado, known as Connect for Health Colorado, families are going to face really steep premium increases or completely become unable to afford health coverage. In short, the shutdown negotiations, or the lack thereof negotiations, really include this key health coverage lever, making it more than just a typical budget fight, but a really huge problem for health access in the country and in Colorado. Additionally, at the federal level, we are responding to various Medicaid changes from the federal bill passed earlier this year, HR 1. Riley talked about this a bit at the top of the webinar, so just want to touch on a little bit of high-level points that he mentioned. So one of the main things we're looking at is how HR 1 narrows the definition of eligibility for federally funded Medicaid funds beginning next year. So we're really going to see a shift in who's allowable for funds to draw down from the federal government into Colorado to cover folks who traditionally have been able to access Medicaid. We're going to see that shift. Those folks should, we're going to be really looking at how we're protecting access to care for those families, and looking at some of our options like our Connect for Health access, our OmniSalud access, and the marketplace. Another area we're really paying attention to is the increase in redeterminations to every 6 months rather than every 12 months. One of the challenges here is just this means more frequent paperwork, more frequent verification documents, which just increases our risk of administrative churn, which means people losing eligibility, not because they are actually ineligible for Medicaid, but because of missed paperwork or missed deadlines, and just an increased burden on both families and our administrative system. And then the last one that I'll just briefly mention is our implementation of work requirements. So beginning in January of 2027, which is very short timeline for a state to create a new eligibility system, Colorado will have to start working with enrollees to make sure they have a minimum hours of work, job training, or community service in order to maintain their Medicaid eligibility. This is not something we currently do in Colorado, and so this is going to be a new eligibility process we have to kind of create from scratch. And one thing that we are definitely paying attention to at the Children's Campaign is that this includes parents and caregivers with kiddos over the age of 14. So really concerned about families not being exempted from this program, this new eligibility. Those are just a couple of the pieces of HR 1 I wanted to mention. There are a couple more, but we're going to be really just paying attention to how to make sure that we mitigate as much harm as possible to our Medicaid enrollees and our neighbors and friends here. So as Sarah and Riley both mentioned, the governor's proposed budget just came out. And unfortunately, health and Medicaid were really at the center of this conversation. As my teammates mentioned, we're diving in more to this in the weeks to come. But we're really feeling hopeful that we can continue to work with the administration and the legislature to ensure that families' access to healthcare and kiddos' access to healthcare is protected as we continue to face these challenging upcoming cuts. So we'll have more information and diving into that more soon. But we are going to be battling some challenges really head on. So for our legislative agenda and strategy for 2026, we're really looking at a couple main areas, all that I've already touched on and kind of in setting this up for today. So first of all, in the private insurance marketplace, Colorado's Health Insurance Affordability Enterprise, also known as the HIE or the Enterprise, helps Coloradans afford access to health insurance through three main areas: through reinsurance, through health premium subsidies, and through the OmniSalud program. And this enterprise has really been struggling to maintain the funding necessary to ensure that health insurance stays affordable, stays accessible, and stays stable, especially as we have this changing federal landscape, as I mentioned, with the enhanced premium tax credits at the federal level. Colorado depends heavily on those enhanced premium tax credits to come into this enterprise program to help stabilize how we pay for health insurance in Colorado. So one of the main things we're going to be looking at in 2026 is figuring out how to make this enterprise more stable and to ensure that folks continue to have access to the healthcare they need year over year in a stable way. Another program that we are going to be paying a lot of attention to is our access to Medicaid and CHIP for undocumented children in Colorado. So the Coverall Coloradans program just began in Colorado on January 1st of this year. So we're not even one full year into this program. And we are really, really grateful to say that it's working and it's working as planned. And children who previously did not have access to healthcare now have access to healthcare, to going to their doctor for their well child visits, to going to those oral health visits, like we mentioned, and really protecting our safety net providers who have been providing this care in an uncompensated way. So we have, around 16,000 children enrolled in this program right now, and really going to, be pushing to protect this program, protect the coverage and the funding for this state-funded healthcare program for kiddos. And finally, we are working in partnership across our hospitals, other advocacy groups, our current administration, schools, and beyond to figure out how Colorado is going to continue to respond to the federal government's moves towards making vaccines less accessible or potentially not accessible at all. So just one, kind of brief background. The Centers for Disease Control and Prevention, known as the CDC, has an advisory committee called ACIP, or the Advisory Committee on Immunization Practices, which recommends vaccines for children, what they receive and on what timeline. That committee has been central to a lot of the changes at the federal level. However, these recommendations are explicitly tied to the Vaccines for Children's program, which is explicitly tied to our Medicaid program. So that's how we determine at the federal level which vaccines should be paid for through Medicaid, and therefore which we determine to be covered in Colorado as well. So those changes, kind of those ongoing conversations, are really critical to be keeping an eye on, considering about half of the children in Colorado have Medicaid coverage, which means half of the children in Colorado receive their vaccines through this program. So our governor has already taken some great steps to protect vaccine access through private insurance plans, as well as earlier this year, Senate Bill 196 passed through the legislature to help Colorado be able to make our own decisions on how we cover preventative healthcare services, such as immunization coverage, which has been a really great start for us to work on in Colorado. However, these sweeping changes that are happening frequently and ongoing are going to be changing our state's ability to access and pay for vaccines. And so we're going to be monitoring that closely and addressing that in our 2026 session as needed. I'll go ahead and stop there and pass it back to Riley.
Thank you, Tony, and thank you, Sarah. I really appreciate the detailed overview and know that you all have a lot you're working through at multiple different angles from the feds, from the government, shutdown, from our budgetary pressures here. So just really appreciate the work you and your teams are doing. We'll pause real quick to see if there are any questions. I did not see any dropped in the Q&A or in the chat, which maybe means that our staff answered everything, but please know that they always are available to answer any questions, help bring any clarity, and we'll be sure to share their contact information here soon. So I don't see any questions in the chat. So, this is about half of our policy priorities, our portfolio that we work on. So we really encourage folks to join us next week when we discuss early childhood in K-12. You can use the QR code here to register. We'll also make sure to send out the registration link and the follow-up materials as well. But please join us next week, same day, same time, for our webinar on early childhood and K-12 priorities. You can also engage with us in a numerous of ways at the Children's Campaign. We encourage folks to join our Kids Flash newsletter to stay up to date on things happening at the state capitol, at the federal government, and just other information that we're trying to get out to our communities. You can follow us on social media. We're on all the different channels. Please do join us and like our posts. Please let us know if we can engage with you on that. And then we're always looking to find ways to engage folks with our elected officials. So we're often putting out action alerts that we encourage folks to fill out and really engage the civic process that way. We'll be sure to include a recent action alert that we have around SNAP and Head Start, around putting pressure on our federal delegation in Washington to make sure that those funds get released. We'll make sure to share that with you all as well. And like I said, here's our contact information. Please feel free to reach out to me, Sarah, or Tony if you have any questions. Them and their staffs are available for you. And we want to make sure that we are a resource for you all, whether it's, the best data, the best research, the best policy analysis that we can offer. Otherwise, we really want to thank you all for taking your time out of your day. We know things are busy. We know that there's a lot swirling in the space right now. Thank you all for your time. Please continue the great work and please reach out if we can be of any help at all. Thanks and have a great day.